This is Scott Becker with the Becker Private Equity Podcast. I'm thrilled today to be joined by two leaders from VMG Health. VMG Health is one of the great firms in the country. Started off a long time ago as really a valuation firm founded by some former Big 8 or Big 4 leaders, and just has done a fantastic job of growing into both valuation, consulting, and a whole bunch of other advisory areas. Largely in the healthcare area, they do a ton of work for private equity funds, looking at companies, looking at investments, sponsored companies, and a lot more. We're joined today by two of their leaders. We're joined by Pam Iapuzzo, who's a managing director, and Deborah Rossi, who's also a director at VMG Health. And we're going to talk about sort of the issues of potential audit targets, what to look at in terms of audit targets, understanding the appeals process, and compliance strategies, typically for healthcare entities or private equity sponsored healthcare companies. We'll talk about audit targets, compliance challenges, successful responses to audits, and strategies for long-term compliance and monitoring. Pam and Deborah, before we get started, do you mind taking a moment to each introduce yourself? Pam, let me ask you to start with yourself.
Sure. Thank you so much. I'm the managing director here at VMG for the Coding and Compliance Division, have over 30 years of experience in healthcare consulting, handling a lot of different compliance audits, a lot of different areas of compliance and different specialties, a lot of provider education components as well. Our firm joined VMG back in 2020. We were one of the first acquisitions for VMG, and we're very proud to be a part of this wonderful team.
Hi, I'm Deborah Rossi, and I am the director here at VMG. Prior to joining the firm, I've worked at a number of large institutions throughout New York and developed compliance programs, revenue integrity programs, and done a lot of acquisition work on the provider side, and now working on the private equity side, working with our teams to do due diligence. And so we've gotten a lot of experience in knowing what firms are looking at prior to bringing on a joint venture or an acquisition, and it's been very eye-opening for all of us, hence the need for today's discussion.
Well, thank you both so much for joining us, and thrilled to visit with you. Let me ask this, because this comes up just regularly. It came up yesterday with a client, private equity sponsor client is looking at acquisitions. What are the current payer focus areas for audits? What are payers after? What are they looking at? Pam or Deborah, do you want to take the lead on that question?
So this is Deborah, and I'll take the lead on that. We're seeing audits in so many different areas that it's hard to focus in on any one area. But I will say that the common trend has always been documentation and medical necessity. Medical necessity is the overarching criterion for any service that's provided. And often practices and providers are not aware of documentation requirements to establish that medical necessity, or the documentation that is required specifically for the type of service that they're providing. So we do see a lot of audits asking for documentation to prove the medical necessity of the service that's being provided. We see a lot of, I'm sure everybody has been seeing that 25 modifier for these separate services, E&Ms and procedures, and all of the payers are currently looking there. So we've been doing a lot of education on that. We've had clients have us come in and look and make sure that everything is okay as far as their billing for that. And always looking at billing and coding compliance is what's getting coded, what's going out for the actual claims. And then provider enrollment. That's a place that a lot of practices forget to look at. Are the providers enrolled correctly? Is their enrollment current? Are there any excluded individuals or entities that they're working with that might be excluded? And then another big area that we're seeing now are the recovery audit contractors and what they're looking at. And they are, they're just doing data mining, and they're sending out requests to practices, and they're looking at Some of the more common ones that we've seen, the joint replacement procedures, injections, the new versus established patient and how you're billing that, and diagnosis inconsistencies. That is a very big target right now because of the fact that the Medicare Advantage plans benefit from the higher level of acuity. And are they actually reporting those diagnoses to the correct specificity?
Thank you. And Pam, to follow up, as payers automate more and more technology, is this leading to more audits? Is this making it tougher for providers and provider-sponsored companies?
I would say absolutely. They are data mining and able to find providers who might be those outliers billing these higher levels of service or billing services at maybe higher frequency than their peers. So it's very easy for them to identify, we have services with physicians and non-physician practitioners like PAs and NPs, very easy from a data mining perspective to identify those services. You can track who the billing provider is, who's placing orders for those types of services like radiology or laboratory, or putting in prescriptions for patients. So it's very easy to identify who's seeing these patients and all of this ancillary back-end work so that you can look at these types of services and identify, is there a potential risk area here? We might want to go in and audit these providers, audit these services. So without question, this automation, we're also seeing in the audits the opportunity for OCR technology to be utilized, which is picking up on templating and clone documentation in these provider notes. So all of this definitely facilitates it from the payer side and certainly puts our organizations and providers at greater risk for audit.
Thank you very much. A next question. How can organizations, this is a key question, how can organizations and providers try to minimize potential audit triggers? Why don't you take the lead on that question?
Sure, this is Pam. I'll take the lead there. They need an effective compliance program. Having that compliance program that looks great in a manual, but is not being utilized appropriately and not effective for providing the organization with the appropriate level of auditing and monitoring to help identify these issues. We look to the OIG does a great job of putting out its work plan for us. That's a guide that's already telling you where their area of focus is, and that should be the organization's area of focus if they're rendering those types of services that are on the audit work plan. Same with the RAC audits, same with any audits trends that we're seeing from the payers. These need to be areas that we should be looking at internally. We should audit those providers who are rendering those services. We should be monitoring to see what reimbursements we're receiving or denial trends we're seeing to help us be able to go back and take a look at that documentation, take a look at the way that we're coding for those services, the way that we're billing. Sometimes the documentation and the coding is appropriate, but perhaps the billing is inaccurate. It's not demonstrating the right individual who actually provided that service on the claim form, or the units or the codes are being changed somehow. The technology is wonderful, but sometimes things just don't fire off appropriately the way that they should for billing purposes. So you've got to look at every area: documentation, coding, and then the billing. Follow that all the way through to be able to help identify any potential issues. And then all of that needs to also look at who the provider is and what is the scope of practice of those individuals. I think that many times our practices take a lot of that for granted. Some of our providers who are rendering certain services based on the service, based on the state guidelines, based on regulatory guidelines, they may not be able to provide those services within their scope of practice. So that's another important piece that is many times overlooked. So we spent a lot of time kind of looking through all of those areas to ensure that each and every item is appropriate so that we are compliant in every way that we can be. So organizations really need to focus on that, as well as any new areas that they might be looking to start providing services in, whether it's a new service line or just a new service that's been provided. Things like transitional care management or chronic care management. These are areas that we're seeing a lot more activity in, or remote patient monitoring. A lot more of that types of services are being seen today, but are we documenting them appropriately? Are we billing for them appropriately? We need to really go back and delve into the documentation and the coding to ensure that it is correct. And that really helps these organizations and providers minimize their potential risk for audits from the payers.
So take us to the next issue, which is the question of when you are audited, what are the key steps of the appeals process? Is this manageable or is it impossible? Should people just give up? What does the appeals process look like? And can you give us a sense of the key steps of the appeals process?
Well, I would say never give up. I know it is an administrative burden on practices to have to respond to appeals, but the way that you can minimize that is responding the first time you get a request and making sure that your response includes all of the documentation that's necessary to support the service that is being looked at for that audit. A lot of times, because of the lack of assistance in putting together what's needed to respond to these audits, the practices will just give the bare minimum. And that is not what you want to do. You want to understand what it is that they're looking for the service that they're auditing, and making sure that all of the documentation that supports is submitted in that response. We also recommend that you go through and highlight the points that you know that the auditor is going to be looking at, so that if you're submitting a lot of documentation, what's highlighted is ready for them to look at. The other thing to remember is that sometimes providers don't put everything in that visit note or that procedure note. There might be additional documentation that supports the service, or there might be additional documentation that has to support the service that came before that date of service. So know what you're being audited on, know what the documentation requirements are, and make sure that you're submitting everything that's necessary to support that at that initial request. And that will minimize the need for additional levels of appeal. We work with a lot of clients, and the first response, they don't give everything that they need to give, and of course the governing body that is looking at them will come back and say, oh, we're not going to pay for that service. You didn't submit the medical necessity or the supporting documentation for the service that you billed for. So that's a big thing, to make sure that we work with the practices, that we educate them. This is what you're going to need to respond to that type of audit. Make sure that all of that documentation is included, and that you're highlighting the points that you know that they are going to be looking for to be included in that documentation.
Thank you very much. In a follow-up to appeals and so forth, what are the typical compliance challenges that providers, organizations are seeing currently? What are the compliance challenges you sort of see with organizations, providers, et cetera?
Well, I think that probably the biggest challenge is the resources to be able to support their compliance endeavors. That's probably their number one challenge. And the provider engagement to want to do this better and to document appropriately and to work within the confines of the regulatory environment. But aside from those big challenges, I think the other piece is really just keeping up with all of these changes. It is a big challenge for all providers and for everybody working in this compliance environment. There are constant changes. We've got January 1st, AMA CPT changes. We've got October 1st, ICD changes. After 25 plus years, we've seen big changes in evaluation and management services. And so this evolution from 2021 through 2023 with all of the E&M changes has been a tremendous challenge to providers, ensuring that they are documenting appropriately and that they've modified their documentation to adapt to these new guidelines and the way that we are now assigning the level of services based on the new AMA and CPT guidelines for 2023. I believe that that's probably one of the biggest issues, is really just the ability to digest those guidelines, change your documentation templates, change your documentation habits to ensure that you are meeting those requirements and ensuring that you're not just assigning levels of service the way you have historically, because the rules have changed dramatically and the documentation requirements associated with them have changed as well. So I think all of those things are tremendous challenges for these organizations and providers, and not having the resources to support these providers, educate them, go back to educate them after you've audited them and found some of these issues, and provide them the tools that they need to be able to do this correctly. If they don't have the right tools, with all the best efforts, they're still not going to be able to achieve a positive outcome as it relates to coding and compliance.
Thank you very, very much. Those are some of the common compliance challenges organizations are facing. What are best practices for organizations around documentation and provider engagement? Keeping providers engaged in this while they're so exhausted and burnt out and so forth is challenging. What are some of the best practices for documentation and provider engagement?
Well, I think one of the biggest things is communication and understanding your providers and the services that they are giving to their patients, and making sure that you understand their workflow. I mean, we will go through with a provider on their workflow and give tips and update templates and the tools that they're using so that it's a little easier for them to understand all of the documentation requirements, especially with all these changes. So continual education is very important, and also educating the staff that's supporting them, because they can help as well. We often will go in and shadow a provider, making sure that the workflow is optimized from the beginning of the encounter to the end, and the documentation and the submission of the claim. And I think that helps to minimize the impact to the physician or the APP, these providers, allowing them to focus more on the clinical rather than the regulatory, because we've made it easier for them to document and understand what the requirements are and how these changes impact them.
And I'll add to that scope of practice piece comes back into play with this as well. Understanding in each state what each level of support staff may and may not be able to provide from a documentation standpoint or a clinical standpoint is, again, another really important part of the process as well. But being able to identify those pieces that the support team can provide for physicians and advanced practice providers is a very big area, because it will, again, minimize the amount of work that the provider themselves needs to do.
Thank you. And speaking of sort of regulatory changes, updates, the greater automation that payers are using, that's made this like an arms race to work with payers or fight with payers, or whatever you want to call it. What steps can organizations take to stay ahead of and adapt to regulatory changes and updates?
They really need to be able to designate some staff to support their compliance endeavors and stay on top of these changes. You can sign up for the alerts, both from CMS and the local MACs, that will provide, changes that are coming through, whether it's an MLN or, any other kind of regulatory transmittal that might be coming through with changes. I think it's really important for individuals to be responsible for kind of looking through and seeing what new information is coming through, being able to digest that information, decide whether or not it's applicable to this organization. And if it is, then we've got to be able to provide that level of education back to the providers. And again, go back to their documentation templates in the EMR, ensure that whether it's the template or their smart phrases or their macros that they've developed are accurate and sufficient, providing them the restrictions or limitations to some of these services. Maybe we're rendering these services and not keeping track of the fact that there are limitations associated with this service, and that we can't just provide that service to the patient at the frequency that we are providing it to them and have it be deemed medically necessary. So there's a number of things that need to be done in order for organizations to ensure that they are staying up to date with these changes. You know, we've got, as I mentioned, the CPT changes, and we've got the ICD, but you also have CCI edits, which are quarterly updates. Most people are not following them. They know that there's a bundling edit with this particular type of service, but that bundling edit that you've known to be true for the last number of years may no longer be accurate. There may have been changes. You know, when things are changing quarterly, someone really needs to stay abreast of those changes and ensure that we are following those rules appropriately and communicating that information back to our providers so that they are documenting and coding and billing appropriately for those services.
And just to add to that, I think an important part of all of this is that you need, as Pam said, you do need designated people to be monitoring all of this. But I think you need also, and involving cross-functional teams helps to make sure that you are monitoring and minimizing impact. Of course, revenue integrity is always important in any organization, as well as compliance. So if you involve both your revenue cycle management, your coding, your billing, and your compliance in the monitoring process of these regulatory changes and making sure the education gets out there so that it does not impact revenue or compliance, that is a very important part of any program in any practice.
Thank you very, very much. And are there ways, these seem so challenging, like it's trying to keep up with the regulatory updates, trying to keep up with payer audits. Are there things that organizations can do to turn some of these challenges into opportunities? How does that look? How do you think about that?
So I think the opportunities there are that you can develop these different teams and understand what they should be looking at, and education for your providers. Adapting to these regulatory changes allows you to understand the services that you need to have, the types of teams that you need to have in place. You can continually evaluate workflows and identify areas for opportunity or areas where you may need improvement. It allows you to continually be looking at the tools that need to be updated, the templates, continually educating your providers and your staff. And that's always a good thing, to keep everybody current, making sure that somebody is always looking at the revenue, at the compliance, and that you're in a good place in case anybody from the outside comes looking. And I think a big thing to note for practices right now is that the OIG has always told you to have an effective compliance program in place. Now they're coming to look and they want proof that you have that effective compliance program in place. So if you can look at these types of audits that you're getting, if you can look at the types of services that the payers are denying or asking for documentation prior to paying, you can develop that effective compliance program to monitor those different areas. And I know, Pam, you've done a lot of work recently, even with shadowing providers and putting programs in place. And I know there's other areas for opportunity that you've recommended as well.
Thank you. Yes. And, certainly with physicians working with non-physician practitioners like RNPs and PAs, seeing how they're working together in these collaborative manners where we've got shared visits or incident 2. These are big risk areas, but there are also opportunities, if you're doing it correctly, to optimize the services that are being provided, optimize the workflow, optimize the billing of those services. But most individuals really don't know those guidelines well, don't know the documentation requirements associated with those services. And so they put themselves at risk. But if they understood those guidelines appropriately and have someone navigating them through the appropriate workflow and associated documentation for those services, it's a revenue opportunity. And I think that there's always opportunities for these practices. You know, when we're looking at compliance audits, whether it's as part of a compliance program prospectively or part of a due diligence review, we are always also looking not only at risk, but looking at the revenue opportunities. There's lots of services that providers are rendering that maybe they're undercoding themselves, or also they're just not recognizing that these are services that can be carved out and separately billed if their documentation is strong enough to be able to support. So we like to educate them in those opportunities. There are always revenue opportunities that we identify throughout these audits that we like to bring to the attention of our clients to ensure that they optimize in those areas wherever possible.
Thank you very, very much. Pam and Deborah, what an amazing practice you've built before and as part of VMG Health. Congratulations. Where can people find out more about what you do? Is the easiest way to go to the VMG website, or is there a better way to find Pamela Diapuso and Deborah Rossi?
Sure. I think our website, our team has worked really hard to update that website to have it really accurately reflect the breadth of services that VMG as a whole is providing. And it really does link you to all of the areas of expertise our team collectively has. And certainly for our coding compliance team, there's a lot of information about all the services we provide that you can locate on that website. And certainly areas that we've given you our contact information. Folks can reach out to Deborah and myself at any time. We'd be more than happy to engage and answer any questions from any of your listeners.
Pam, Deborah, and the VMG Health team, thank you so much for joining us on the Becker Private Equity Podcast. It's always great to visit with you and your team. Thank you very much.
Thank you.
Thank you for having us.